Hi guys, this is Lily here at Aspiring NP, just tuning in on my lunch break to give you a couple tips, in total, 4 tips to succeed and make sure you succeed in your clinical site. I know there's a lot of you that are currently looking for clinical sites or finishing up your clinical hours at your current site or in the process of starting another one in the fall. So these are 4 things that I just wanted to make you aware so you have in the forefront of your mind. And the first thing I wanted to talk about was adding gratitude to your attitude. And I cannot express how important this is, really, to make sure that all your words and your behavior shows how thankful you are to be there, that you are a guest, that you don't feel entitled, and I'm sure this goes without saying, that you don't come across like you're better than anybody, including you or your preceptor or medical assistants, or really anybody else that you may come across. So adding attitude and gratitude to your attitude, staying thankful, is the first tip. The second tip is to make yourself indispensable. So how can you do that? Every clinical site is different, but you can make sure that you're helping your clinical instructor with as many charts as possible, that you review lab works and flag things for him or her, that you stay a little bit after after you're supposed to, kind of like helping sort things out, that you take a quick look at the next day's appointments to see who you have to be focusing on and researching things ahead of time. I don't know, there's a lot of different ways that you offer a helping hand at placing patients if they're short on staff, while the clinical instructor is finishing up paperwork or prescriptions or whatever. I don't know, just kind of going out of your way a little bit to make yourself indispensable. The third tip is to befriend your medical assistants, because your medical assistants and your nurses, which will be supporting your clinical instructor, are pretty much the backbone of any practice. And more often than not, they are kind of sitting in the back room, especially the nurses, making phone calls, don't really get to go out and interact with anybody unless they have a nurse visit schedule. The medical assistants are more of, they set up the patients ahead of time, but these are the people that you really should be making sure you go out of your way to say hi to every day, to acknowledge their presence, to thank them whenever they send you a message or whenever they remind you of something, because if you make them happy, they will make your life way better, and your job easier as well, and your stay more pleasant, which is kind of what it's all about. So it's going to help your learning process too. The last tip, and the 4th tip, is to not overshare. It can be easy when you're in a setting where you're sharing a lot of time with people and thinking like you're becoming friends, and kind of share lots of stories about your life, mishaps, sad things, sob stories, relationships, all these other things, with different people, like your instructor or your medical assistant or other kind of office staff. Not a great idea. Definitely not, because you want to be seen as a professional person. Remember, these people are not your friends; they're your mentors and your preceptors. So you're supposed to be there in a professional capacity and not taking the topic or on a personal level, or talking about things that not everybody agrees with, like politics, or views that may seem to some that are extreme. You know what those off-limit topics should be. But anyway, nobody needs to know on your clinical side, if and only if after the fact of your clinicals you do end up becoming friends with the preceptor or the clinical staff and you actually continue to stay in touch and you want to share those views, then fine, by all means. But during your clinical staff, during your clinical rotation, is really imperative and important that you don't do anything that could possibly in any way jeopardize your stay there, or be seen as something that could jeopardize your stay there. People, you know, you may not see them coming, as it happened to me. You know, one day things were fine and a week later things were not. So just really make sure that you stay there in a professional capacity and that you keep those 4 tips in mind. Just wanted to thank you for tuning in today and for checking these 4 tips and for continuing to stay engaged in the Facebook group here at Aspiring NP. Take care and have a nice rest of your day. Have a good one.